Hello, everybody. So, welcome today. I have got with me Dr. Pavan Yadav, a veteran in physiotherapy who has worked at multiple places and he believes in technology. And since the topic for today is how is technology making a difference in the world of physiotherapy, let us talk about that. So, is technology really making a difference in the world of physiotherapy? Welcome, Pavanji. So please tell us a little bit about your practice. When did you pass out? From which college? How many years you've been in practice? And what is your take on technology in physiotherapy?
I'm Dr. Pavan Yadav. So basically, I had practiced from 2010 January. I had started my first job in Mission Health Multi-Specialty Physiotherapy Center. That was my first and last job. And after that, 2016, I had founded my own institute, which is a center with 3 branches. And in 2024, I sold that branch and started with my new venture with the name of Isha Physiotherapy and Advanced Rehab Center. We have 2 branches in Ahmedabad right now, Nicole and Naranpura. I had completed my bachelor's in RGUHS, Karnataka in 2010. And after that, I had practiced with physiotherapy. And from last 15 years, I'm using the software, which is developed by me with the help of my friends and developers. So we had developed the software in the physiotherapy, and I'm working with that from last 15 years.
So
And
you've always used only this software, or where you were working, other places you have been exposed to other software as well?
So that was the software which I had introduced in multiple centers where I had worked. So that was a software which is developed by me, but
And you're
still,
using the same software right from
still
the
I am
beginning.
open for the upgradations and inputs
And this software has been developed by you from the
from
scratch.
the scratch.
Okay, and you are using only that software. And you are upgrading it regularly?
Yeah, every 6 months we have a meeting with our developers, and they give their inputs in the software, and I give my challenges to those developers for the upgradation of the software.
So the very fact that you're making your own customized software, you feel that the software which is available in the market is not fulfilling all your needs?
Previously was I was exposed to the softwares, so I had faced multiple challenges in the software which were in the market. But right now I am thinking we have to change the things, and we can have a better softwares in the market right now.
So rather than using the ones which are available in the market, you feel that a customized software will help a physiotherapist more.
Right now I am thinking we have to switch the software from my development point of view, that because we need professionals to the
And
field.
different professionals have
Yes.
different practices.
So we
So
need
the different needs are there.
yes. So
All right.
we have different needs and different demands from all the practitioners.
Now, there are a lot of myths associated with using technology or a ready made IT software. What are the myths basically that I come across is that I have to switch over from paper to a computer, and that switch will make me lose a lot of data. So, is this true? Does it really happen when you switch over from, paper to computer? There are a lot of glitches.
It's not true. Basically, it's not true. But physios are like they are basically dependent on the paperwork right now also. So there are multiple physios which are practicing on paper-based systems. So I definitely believe that those physios or medical practitioners switch to softwares for
They
the
should.
easy management of patient scheduling everything.
So, the switch is not all that scary that it looks.
It's not scary, but they are scared of the switching process. And
I think
because
the other thing they are scared of is that, will they be able to understand the software and use it? So is it difficult?
That is one of the issue which they have in their minds, but there is no issue in practical.
Okay.
Because
And
they
the
think
third most important one, it's very expensive.
it's not expensive basically. It's expensive when you are the developer, but it's not expensive when you are buying somewhere with the professionals, from the professionals.
In the long run, I think it gives you more profit.
It gives more profit than your paper based work. It's not expensive basically. In the long run, you will be having more profit while using the software, because it gives you proper scheduling of the appointments, proper scheduling of the follow up of the patients, and including that, you will be delivering the best things to your patients for the.
Another thing that I have noticed, most people, the complaint is that the softwares are for big hospitals, when they have a big practice with about 40 to 50 patients coming in every day. I just have 10 or 12 patients in a day. So why do I need a software? So do you think that point of view is correct?
Few of my friends also thinks about the same thing, but I always correct them.
So, do you feel that a small practice will benefit equally, or they don't deserve the software which is made for big hospitals?
Basically, software is made for everyone. It's not about big hospitals or small clinics. They have multiple options in the software. You can start from small scratch and you can upgrade to the bigger ones or upgrade to the bigger upgrades like appointment scheduling and follow-up systems.
I think the follow up systems are the biggest issues that almost any physiotherapist is facing. Whether the patient is complying with the exercises given, whether the patient is coming for the regular checkups. Like if you are doing 40 patients in a month and you fail to call up one and the follow up is not done, there is a chance you may lose the patient, or maybe the treatment that he has undergone will not be as fruitful as it would have been with a follow up.
100%.
So, in this situation, the software, does it have those modalities which help you do the follow up?
Software helps in follow-ups. Obviously, they give you reminders for the follow-ups. So there will be someone in the department which will be taking the follow-ups, and software will give the reminders to the person, the telecaller which you will be hiring. So software helps you in that follow-up system, and definitely it will give you an exact date and exact
So
time.
even if you have 12 patients, it works. Whether you have 40
whether
patients
you
or
have
12.
12 patients or you have 200 patients, it will work for you.
In fact, it will help you to increase from 12 to 40
100%.
if you're using a
I'm
software like
using
that.
from last 15 years, and that helps me in growth of my institute.
What about exercises with the help of images? Are you able to give that to your patients as
That
well?
is much better in with the help of software rather than your paperwork.
So just giving a paper, eyelining the exercises. If you give them a message that these are the exercises you're supposed to follow, it's easier with the software.
Yes.
This is something that I have always believed. I am a dentist, and as a practicing dentist, sometimes the clients come to you after 2 years, 3 years, maybe with the same problem. But because they were so happy with the last treatment, they want this treatment done with you again. And you are working on about 20 patients in a day, and after 3 years, you probably don't recognize the patient. You don't even remember which tooth you've worked on or which joint you have worked on. So, does your software have any modality in it with which you can recognize who the client is, what you did on him, and what benefited him, and maybe plan your treatment accordingly?
Yes, my software has a option of capturing a photo of the patient. So that gives me the reminder before the patient is entering to my cabin.
What about X-ray records?
When everything, X-ray records, the last treatment which I had given, the last discharge sheet with the happy quotient of the patient and the star ratings and everything. So I get to know my patients are getting this much relief in the last session, or XYZ things they had treated we had treated the patient, and after that the patient shows their trust that still I am remembering him.
Another question that I wanted to ask was about governance and compliance. I have found that a lot of people are worried that their data is being leaked. Data is king right now in today's world. And many of the softwares are storing data on the clouds. And there is a chance of data theft. And if it is a very VIP kind of a patient and their data tends to get, robbed, in that case it can become a very public and legal issue. So is this really a serious threat, and are all softwares having some kind of ways of going about it, or is the risk high?
I was having same experience and fear previously, but after so much updates in the software also and in the technology also, right now there is no issues with the data theft or data tracking.
So it is a safe software. That fear is a myth, basically.
Yes, it's a myth.
All right. And last but not the least question, what I would like to tell is your fellow physiotherapists, the ones who are still not using softwares, they are worried that their small practices don't deserve a software. They need to become a big hospital. What is the advice you can give to them regarding software, regarding the use of technology, regarding the use of IT softwares, for their day-to-day practice, managing data, managing patients, and the treatment?
They still have fear of like changing or upgrading. So my message to all the physio fellows and all the medical practitioners, they should start with a small features like appointment scheduling or payment follow-ups. And then they can upgrade the software and they can upgrade the features also.
The fear in this is that they will not get anybody to train them, or if the software has a glitch, there will be nobody to help them correct it. Is that true, or is there
right now software comes with an IT training also, and you don't need IT people in your team for the upgradation and for the practice.
So
They
they
will
come
be
and give
giving
you
you
help.
all the training for like 15 days, 30 days. They have all the programs. They will be training your staff.
And
for the same.
when they require an upgrade, they will help at that
They
time
will
as
help
well.
you for the upgrade also.
So
They
actually,
give
it is a
retraining.
very friendly environment where
Yes.
technology is
Right now,
concerned.
platforms are very easy. It's like using your WhatsApp, and right now you can go with any of the platforms.
WhatsApp is easily understood.
Yes.
So if WhatsApp is
So
understood,
people are
then
using
everything
WhatsApp
can.
and Facebook right now.
Okay.
So basically, my message to all the fellow physios and medical practitioners that they should start with a small feature like appointment scheduling or like follow-up system. They will definitely get the results and they will see the practice grow.
Thank you very much for giving so much of your time on such a busy day, Dr. Yadav. And we hope to keep learning more and more from you. And best of luck for your new practice, sir.